Welcome back. For this lecture, let's talk about some of the common medications you're going to see and be able to administer as an EMT. Understanding that medications vary widely from service to service and state to state, so you'll want to ensure conformity not only with your local state regulations, but your EMS services, policies, protocols, procedures, and guidelines. Before we get into discussing individual medications, let's talk about some things that we should consider for every medication that we give. Remember that there are rights to medication administration that you should be familiar with and verifying before administering any medication to any patient at any time. First of all, we should verify it's the right patient. It's the right medication. Don't just assume because your partner hands you a medication that it was the appropriate medication. And you should also double check yourself and make sure this is the right medication for the right patient. Does the patient indication warrant the use of this medication? Verify your dose prior to administration. Make sure you're given the medication via the most appropriate route. Is this a sublingual medication, an oral medication, or a medication that needs to be given intravenously via an IV or intramuscularly with a syringe? Is it the right time for the patient? This becomes particularly important with ensuring that you deliver medications in a timely manner and making sure that you reassess and re-administer medications as needed in the appropriate repeating dose time. Make sure that you are prepared to have the right documentation and right reporting for the medication administered. And also make sure that you've performed the right assessment to ensure that this patient indeed requires this medication for their given presentation. Remember that patients have the right to refuse any medical treatment. Make sure that you're prepared to do the right evaluation following the medication administration. And make sure that you're informing your patients prior to administering any medical treatment. All right, for the EMT, we have some common medications that are given orally. These are medications that a patient will take and swallow. So for these medications, you need to ensure that the patient has a patent airway and the ability to swallow. You may instruct the patient to swallow or chew the medication, and they should be able to follow those medication instructions. Oral glucose is one of these medications. Remember that glucose is a sugar that cells use to create ATP or create energy for the body. It's used in the treatment of hypoglycemia or low blood sugar, and EMTs give it only by mouth. Because you're placing this in a patient's mouth, the patient should not be unconscious, and the patient should be able to protect their own airway. Aspirin is another medication that's given orally. While it's taken over the counter to reduce fever, pain, and inflammation, we give it predominantly in EMS as an antiplatelet aggregator, or in patients who are having an acute myocardial infarction, an MI, or a heart attack. It inhibits the plates from grouping together, making the clot worse, causing significant increase in damage to the myocardial tissue. Contraindications for this medication include hypersensitivity to aspirin, liver damage, bleeding disorders, asthma, and it should never be given to children. Sublingual medications are medications that are delivered underneath the tongue for direct absorption into the blood vessels through that capillary membrane. The advantages for this, it's easy to advise patients. It's for quick absorption, so it gets a more rapid uptake into the bloodstream for more rapid effectiveness. Some disadvantages, because again, you're placing this in the patient's mouth. It requires constant evaluation for the airway. There's a potential for choking, and the patients may not be cooperative, and you can't administer it in the unconscious patient. The most common sublingual medication that we'll give as an EMT is nitroglycerin. This is given to relieve angina pain or chest pain in the cardiac patient. It increases blood flow and it relaxes veins, and it's either given in a spray form or a tablet form. Before administering nitroglycerin, you need to ensure that you check blood pressure. One of the significant contraindications is a blood pressure lower than 90 millimeters of mercury systolic. You also, as this is a prescription medication, need to have either a standing order or an online order to approve the use of this medication. If the patient doesn't experience relief of their chest pain after administering the medication, it can be an indication that there's a more serious event than angina, such as an MI. It should never be used with erectile dysfunction medications, and you should confirm this before administering nitroglycerin. It may also cause a mild headache for patients after administration. For administration by tablet, you're going to place it sublingually under the tongue, and there may be some slight tingling or burning. Storage is important for this medication. It should be secured away from sunlight and exposure to the elements. If it's a metered dose spray, you should do it on or under the tongue preferably, and one spray is the equivalent of administering one tablet. Repeat dosing, you should wait 5 minutes before repeating any dose. You should always be reassessing vital signs, and since nitroglycerin can be absorbed through the skin, even though you should already be wearing gloves, make sure you have gloves in place while you're handling the medication. Intramuscular medications. Another advantage to intramuscular medications is they're quick and easy to give to the patient. There's a relatively high metabolic uptake rate, so they can uptake that into the bloodstream and metabolize that quickly, much faster than giving something orally. Disadvantages, it does require the use of a needle, so there are risks to you and your partner of needle stick injuries, and you need to make sure that you're appropriately handling the sharps device and placing it in the sharps container once you're done. The patients may also have fear of pain or injury associated with the use of needles. One of the main medications that you'll be giving, oftentimes as an auto-injector device, is the use of epinephrine given intramuscularly. Epinephrine controls the flight or fight response, and it's the primary medication that we give at the EMT level, pre-hospital, intramuscularly. It may also be called by other names such as adrenaline, and it belongs to a class of medications called sympathomimetics, or sympathetic nervous system mimicking drugs. Another medication that you may see given intramuscularly or intranasally is naloxone. Naloxone, or Narcan, is used to reverse the effects of an opioid overdose. Some important considerations with naloxone: you should be consulting medical direction prior to the administration, and the effects of naloxone may not last as long as the opioids, so repeat doses may be necessary. Naloxone administration, because it is an opiate receptor inhibitor, can cause severe withdrawal symptoms in the patient, and this medication should be titrated when administered to only bring back respirations in the patient. You should not be attempting to awake the patient fully. As mentioned, naloxone can not only be given intramuscularly through an autoinjector or medication drawn into a syringe and administered intramuscularly, but it can also be administered intranasally. The device that you see on the end of the syringe placed in the patient's nose is what's known as an atomizer. This takes the medication and makes fine particulates so it's allowed into the nares and absorbed in the nasal passageway with the close capillary beds at the mucous membrane. It is the most common method of administration for naloxone for the EMT or first responder. Other types of medications are oxygen. This is an inhaled medication. We've talked extensively about oxygen in the airway and respiratory chapters. It is administered via non-rebreather mask, nasal cannula, or perhaps a bag valve mask, and all cells need oxygen to survive. Fundamental treatment principles with oxygen is if a patient is hypoxic, they should always be receiving oxygen. But if a patient is not hypoxic, oxygen is not necessary and should not be administered. Other types of inhaled medications that you may encounter or use: you may have MDIs, or metered dose inhalers, and nebulizers. The function of a nebulizer is to turn liquid into a mist or spray from the metered dose inhaler that can be inhaled and delivered into the functional portion of the lungs, specifically the alveoli. This has a fast absorption rate, and it's an easy route to access, and the medication delivery method is portable, particularly with the metered dose inhaler. Make sure if you're using a metered dose inhaler, you need to have a spacer in place. The spacer is the device that you see on the screen attached to the metered dose inhaler. Here's the inhaler, and this piece is the spacer. That spacer should be used, one, to ensure that you can reuse the medication with the next patient in a manner that's safe, but also allows time for the patient to, when they inhale, to inhale all of the medication at the entire time. You may use small volume nebulizers. These are common to see in EMS, and you may use this to deliver medications such as albuterol, Xopenex, or Atrovent. These medications are inhaled and used in the treatment of patients with respiratory distress who have COPD or asthma. It does take longer to deliver the medication than the metered dose inhaler, and it requires external air or oxygen to power that nebulizer device. It's more effective in patients with moderate to severe respiratory distress, and it can be used in conjunction with other airway tools such as a non-rebreather mask or a CPAP or a bag valve mask to deliver medications while assisting ventilation. Medication errors are a big problem in medicine, and we should be doing everything as an EMT or EMS provider to prevent medication errors. We talked at the beginning of the lecture and a reminder of those rights of patient administration. Inappropriate use of medication can lead to patient harm, so we should do everything possible to minimize errors and make sure that we're using the right medications for the right patients at the right time. Make sure that the environment doesn't also contribute to errors. You should be delivering medications in well-lit areas and confirming with your partner whenever available prior to delivering a medication. Make sure that we provide the appropriate patient care if a medication error does occur. You should immediately notify med control. Make sure you're following any protocols or guidelines set forth by your agency or department. You should document medication errors thoroughly, accurately, and honestly. And then you should talk with your partner, supervisor, and med control physician following any medication errors to figure out how to learn from that mistake to prevent future mistakes and make sure that we're delivering the most effective care for our patients whenever possible.